A traffic jam starves the city. I want you to forget clot-busting medications for just a minute. Forget CT scans. Forget the NIH stroke scale. Let's understand the story first. Imagine your brain is a huge city. Every neighborhood depends on one major highway. That highway delivers oxygen, glucose, workers, supplies, everything the city needs to survive. Now imagine a massive semi-truck jackknifes across the highway. Traffic comes to a complete stop. Ambulances can't get through. Food trucks can't get through. Nothing gets beyond the blockage. At first, the neighborhoods beyond the accident are still standing. But minute after minute, they begin shutting down. Streetlights go dark. Businesses close. Everything slowly stops working. That's an ischemic stroke. The brain isn't broken, it's starving. And the longer the traffic jam lasts, the more brain cells are permanently lost. The entire disease in one picture. Now that we understand the traffic jam, let's watch what happens next. A blood clot blocks an artery. Blood flow suddenly stops. Without blood flow, oxygen stops arriving. Brain cells can't store oxygen. They depend on a constant delivery. Within minutes, those cells stop working. And here's the important part. The symptom depends entirely on what that area of the brain normally does. If movement lives there, movement disappears. If speech lives there, speech disappears. If vision lives there, vision changes. The brain isn't randomly malfunctioning. It's simply losing power in one specific neighborhood. The symptoms tell you exactly where blood flow has stopped. Remember, brain. Since every minute matters, I like remembering the word brain, because that's exactly what we're trying to protect. B stands for blood flow blocked. That's the entire problem. R reminds us of rapid recognition. Time lost is brain lost. A is assess deficits. What functions has the patient suddenly lost? Speech, movement, vision, sensation? I stands for immediate imaging. We have to know what's causing the symptoms before treatment. And finally, N reminds us to involve neurology now. Stroke care is a team effort. Remember brain, and you'll remember the first priorities every time. Why symptoms happen. Now let's answer one of the biggest questions students ask. Why doesn't every stroke look the same? Imagine your city has one electrical transformer explode. Only the neighborhoods beyond that transformer lose electricity. The rest of the city keeps working normally. The brain works exactly the same way. One artery supplies one group of brain cells. If that artery becomes blocked, only those cells stop working. A stroke affecting the speech center may not affect movement. A stroke affecting movement may leave vision completely normal. A stroke affecting vision may leave speech untouched. The symptom is simply telling you which neighborhood lost power. Once you understand blood flow, stroke symptoms become logical instead of something to memorize. Recognizing a stroke. Now that we understand why symptoms happen, how do we recognize them quickly? Remember BEFAST. B is balance, sudden dizziness or loss of coordination. E is eyes, sudden vision loss or double vision. F is face. Ask them to smile. Does one side droop? A is arm weakness. Can they hold both arms up equally? S is speech. Slurred words, wrong words, no words. And finally, T is time. Time to activate the stroke alert. Because every minute blood flow stays blocked, millions of neurons are at risk. Early recognition changes outcomes. Ischemic versus hemorrhagic stroke. Now let's answer another important question. Are all strokes the same? No, there are two major types. Imagine a garden hose. First, tie a knot in the hose. Water can't reach the flowers. That's an ischemic stroke. Blood flow is blocked. Now imagine the hose bursts open. Water sprays everywhere. That's a hemorrhagic stroke. Now the problem isn't blockage, it's bleeding. One stroke needs blood flow restored. The other needs bleeding controlled. Those treatments are completely different. And that's exactly why we never guess. We image first, then we treat. Treatment. Save. Now that we know there are two different kinds of stroke, our treatment starts making sense. Remember save. S is stroke alert. Activate the team immediately. A is assess the last known well time. This is one of the most important questions you'll ask. It helps determine which therapies may be appropriate. V is verify imaging. We must know whether we're dealing with a clot or bleeding. Only imaging can answer that. Finally, E stands for endovascular therapy or thrombolysis when appropriate. Think back to our traffic jam. The goal is simple. Get the truck off the highway. Restore traffic. Restore oxygen. Restore brain function as quickly and safely as possible. Nursing priorities. Once treatment begins, our job is far from over. I remember check. C is continuous neurologic checks. Watch for changes. Even small ones matter. H reminds us about head-of-bed positioning as ordered and protecting the airway. Many stroke patients lose their ability to swallow safely. E is evaluate glucose. Hypoglycemia can look almost identical to a stroke. Always check it. C stands for cardiac monitoring. Atrial fibrillation is one of the most common causes of ischemic stroke. Finally, K is keep blood pressure within ordered goals. Too high or too low can worsen brain injury. Stroke patients require constant reassessment. Why the CT scan comes first. Before we can remove the traffic jam, we have to know what's actually happening. Imagine a detective inspecting two water pipes. One pipe is blocked. The other has burst open. From the outside, both neighborhoods have no water, but the repairs are completely different. That's exactly what the CT scan does. It answers one critical question. Is the artery blocked or is there bleeding? We never give clot-busting medication until bleeding has been ruled out, because the wrong treatment could make everything worse. CT isn't delaying treatment. CT makes the correct treatment possible. Case study. Let's put everything together. A 72-year-old suddenly develops right arm weakness. Their face droops. Their speech becomes slurred. Symptoms started just 35 minutes ago. Blood glucose is normal. Blood pressure is elevated. What's your first priority? Not the medication, the clock. Time is brain. Activate the stroke alert immediately. Establish IV access. Determine the exact last known well time. Check glucose. Perform a focused neurologic assessment. Obtain emergent brain imaging. Place the patient on continuous monitoring. Everything we do is focused on one goal: restore blood flow before another neighborhood goes dark. 3 pictures to remember. As we finish, I don't want you remembering medication names. I want you remembering 3 pictures. Picture number 1, the jackknife semi-truck. A blocked artery stops blood flow. The brain begins starving. Picture number 2, the city power outage. The symptoms tell you exactly which neighborhood lost electricity. Speech, movement, vision, sensation. Each symptom maps to blood flow. Picture number 3, the tow truck. The goal of stroke treatment is to restore circulation as quickly as safely possible in eligible patients. Remember our 3 memory words. Brain, blood flow blocked, rapid recognition, assess deficits, immediate imaging, neurology now. Remember save, stroke alert, assess last known well, verify imaging, endovascular therapy or thrombolysis when appropriate. And remember check, continuous neuro checks, head of bed as ordered and airway protection, evaluate glucose, cardiac monitoring, keep blood pressure within ordered goals. One final thought. Don't think of a stroke as a weak arm or slurred speech. Think of it as a highway to the brain that suddenly closes. Every symptom is simply a neighborhood that lost its oxygen supply. Every minute that highway stays blocked, more brain cells are lost. Your job as an ER nurse is to recognize the traffic jam, determine whether the road is blocked or bleeding, and help restore circulation as quickly and safely as possible.